Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, folks, we're back again, taking a deep dive in some of the elements that we have here at our Gold Lactation Online Conference 2023. You can find out all the details about registration, of course, over on our events page at goldlactation.com. Super easy. You can also find out about all the different elements that we have. What does that mean? Well, it means, again, this year, we have taken it up a level in learning. We love to do that here at Gold because we are always looking at different ways that you love to learn. So we base it on your feedback. You tell us what you want and we bring it to you. And today, once again, we have Julie Matheney. You may recognize her name. She was actually with us last year and did a fabulous presentation with us. But of course, she is back by popular demand, and I'm super excited. I love learning from you, Julie. So welcome back. It's so good to have you here today.
Thank you so much. It's such an honor to come speak with you again, and I'm really excited for the topic this year.
That's right. And Julie and I, well, her and I are planning a date. We're hoping to get together really soon. You might even see us on camera at one point. Who knows? But I'm excited that for now, you're going to be with us virtually. And of course, you will be here with us live. So this is some of the things that we do here, of course, at Gold Lactation. Many of you will know that our presentations are live as well as recorded. So it really lends into people's schedules, but also their learning styles. Some people like to be quiet and focused. Other people like to be part of what's happening in the bigger movement. Now, for interactive sessions, really, it's about coming online, bringing yourself and being prepared. As part of this particular session, Julie's given us some questions for you to do some what we call some pre-homework. Now, it's not required, but I will say that it'll help you get prepared and get you focused in to this particular topic. Julie, tell me a little bit about what you love about learning. And I think, again, you're sort of an educator that loves this sort of style. That's why we've had you back,
Yeah.
But tell me about those things.
Yeah, so if you follow me on social media, you know that I love to take one little teeny tiny topic, break it down into one bite-sized chunk and give you some good quality research-based evidence on that. So when I'm learning, I like to learn in these little teeny tiny chunks. I like to take one topic and do a deep dive into it, explore it, figure out why it works. So in this presentation, that's what we're doing. We're basically taking these little bite-sized pieces and making them easily digestible. So in this topic, we're talking anatomy and physiology. I loved learning anatomy and physiology in college because it's concrete. It is what it is. This is what it's named. But what I found lacking was connecting the dots. You can learn from a picture, but then how does it actually apply to the patient before you? So we're going to be taking these little teeny tiny bite-sized chunks and figuring out how to make it more applicable in practice for that person in front of you.
Yeah, absolutely fabulous. And you're teaching from one of my favorite point of views, which is clinical case studies. And you've titled your presentation, Clinical Case Studies, Things That Make You Go, So I just love the title. I'm like, really? Okay. And then you'll really see when you jump into Julie's presentation, why it is titled that way. There really are things that make you go, And I know for all of you who are coming into this session, bring those moments that have, been conflicting in the literature, that have caused you to question things, that you have had to reach out to your cohort and your, other professionals in your community. So we want to hear from you during this session. We want you to get excited. And of course, as always, Julie will be here answering your questions, taking a deeper dive into the topic, physiology, anatomy, and of course, talking about all things that are happening in her case studies. Now, Julie, when you were building out these case studies, I know when you and I first started talking about it, you were like, oh, I've got something really good. But tell me, you've had those moments where you've been with clients where you've had to question things, you've had to reach out to other folks, and so how has that been for you? Talk me through like some of that momentum you get.
It's wild, right? So anatomy drives physiology, which causes symptoms. And anatomy is anatomy, right? I have a nose. This is a nose, but my nose is unique and different to every other nose. So how my nose is shaped and formed and looks will impact how I breathe. This is the same concept with the breast. We all have had to take anatomy to become lactation consultants. We all know the structures of the breast, but what I think we don't always take into appreciation is how different and unique that is from person to person to person. We should have a breast with an areola with a nipple, basic anatomy, but everyone's breast is a different size and shape. Every areola is a different width and diameter. Every nipple is a different length. So when you understand anatomy, it's not a simple thing, right? It's so unique and different, and how that person's anatomy is will impact how it works. So I've had these aha moments with patients where I'm like, I know I see this anatomical structure, but it's not working how I'm anticipating that it should work. And it's making me go, what is this? Why is it doing it? And again, there's two patients here, right? We have a baby, and that's a whole other anatomy physiology. We're talking just about one anatomical structure, the breast. So we're just talking about this unique anatomy and physiology. And so I really want to like take it down to the micro to then look at the macro.
Fun times. I'm super excited. Of course, I've even had a little bit of a sneak peek at your presentation as we've been getting you all set up with lights and camera, as I say, and I know now what's going to be what you guys are going to be learning. I've had that little insight. But let me tell you, you have got fascinating cases that I haven't seen before. Just saying. So bring I would say, like, bring it to us on the day, bring your unique cases as well. I'm going to have an opportunity to sit with Julie after her presentation as well. And, take a little bit of time, take some of your questions. So we really want you to have the opportunity to come and sit with Julie and myself and sort of just discuss all of these things. You can take it as a debrief. I know that your clinical practice is going to be enhanced because of what you're going to be seeing in this session too. So if you're curious right now about anything that you've heard, you should head over to the website right now, goldlactation.com. You can check out all the interactive sessions by clicking on the left-hand panel. So this is for everybody that's already registered. You can click over there, and you'll also be able to log in and get all of the pre-homework questions for all of our interactive sessions. So that's going to be super cool. Julie, tell me, I know that you love breaking things down, as you mentioned on Instagram. How do people reach you over there?
They can go to @LALactation to find me on Instagram. Everything for me is the same. I like to keep it easy because you got a lot to remember in your life. So my YouTube channel is LA Lactation. My Instagram is LA Lactation. My website is lalactation.com. You can reach me with my informal email, lalactation@gmail.com. I'd like to keep it simple so that you can remember.
I love that. Well, you won't forget it, and you heard it here. So make sure you also follow Julie on social media, and you can keep up to date with all the bite-sized pieces of information that she's going to break down for you there as well. Julie, I really appreciate learning from you, my friend. It's always a lot of fun, and I always say, like, I have to have fun while I'm learning. That's just my style. I know for many folks coming in, not being with people for a lot of part of the year, coming to our Gold Lactation Conference is really a highlight in the sense that we get to work together. So, let's do some deep dive work together, but let's have fun while we do it. Thank you again for, putting this presentation together.
Yeah, absolutely. I'm really excited. I hope you come learn with us. And obviously, if you can't make it because of the time zone or because of the time of that, I really do hope you watch it recorded. I do think you'll learn a lot from it.
Excellent. Yes, absolutely. And if you are watching the recording, you can still ask the questions in the forums. So thank you again to Julie Matheney for being with us here today. And of course, to all of you, our viewers, thanks for chiming in, and we'll look forward to seeing you once again. Bye-bye for now, everyone.